Hello, everybody. We thought as we are finishing up the year, a very busy year, that we'd like to do a review of what's been happening in 2023, as well as what's in the pipeline for next year, and reflecting on what we've achieved and how we move forward to ensure we are really, truly working in an organic and very collaborative way. So firstly, I'd love to introduce the team because not many people get to see who is behind the scenes at PHA core team, and thought it would be a lovely way of introducing. So I'm going to pass over firstly to Mags, who is going to introduce himself, tell us what he's been working on and what he will be doing next year.
Hi everyone, my name's Mags. Thank you for the introduction. I'm the IT guy. I kind of build websites and help with kind of IT technical issues and stuff. So that's basically what I've been doing. I built a new practitioner directory, for example, and I'm working in the background answering support questions and things like that. I'm really looking forward to next year because going to be launching a new site for the PHA, and there's going to be lots of support questions, I'm sure. So yeah, that's me. Nice to meet you all.
Thank you, Mags. And Lisa.
Everyone, I think some of you will know me from interviews I've done with some of our partners and affiliates. That's been the lion's share of my role during 2023 is bringing in partners and affiliates, as well as welcoming lots of lovely people in from around the world. So I keep my eye on the international groups and help wherever I can do. I've also spent a bit of my time this year in finally myself and Amanda, having gone around the houses so many times in terms of our legal structure, we finally created and incorporated ourselves as a community interest company. So with that has come a bank account, and there's the accounting to make sure that things are going to be reported correctly. So that's been 2023 really, and in 2024 we are going to need more support from volunteers. Hopefully this will inspire people, but I'm going to be spending more time focusing on the care sector of society. So we'll talk about that later on. And also I'm very excited to be involved in setting up a fully integrative clinic in my area where I live in Garstang in Lancashire. So it's following a very similar model to Lisa Steele, our ambassador, who has a clinic in Hampshire and one in London. And we're really excited to be doing that. So that's going to take up a lot of my time in 2024, I think.
Thank you, Lisa. Jane?
Hi everyone, I'm Jane. I oversee the social media side of the People's Health Alliance, looking after Facebook, Twitter, Instagram, Telegram. Really proud to say that we've got around 30,000 followers all over, basically monitoring those accounts, checking for messages, queries, and just general upkeep of these accounts. I also help with projects too. This year, proud to say I've hosted a couple of mental health Zooms with our ambassadors and some others, and also some other mental health practitioners too. Next year, we're hoping to complete the mental health project. Obviously decide where funding is going to be going. A big thing as well is gathering volunteers and training people up, and looking at collaborating with more organisations and focusing on hubs. So that's me.
Thank you, Jane. And Kerry?
Hi everyone. You may know me from Wellbeing Wednesday and also other presentations and hosting. my main role is to look after the education side of PHA. And also you might have seen some of the Monday on the Mend little canvas that go out every week, giving some tips on health and well-being. This year has been really busy with presentations, and hopefully we'll streamline them a little bit more next year with your help. So please get in touch with ideas. And also I'll be helping build resources for the website. So there should be lots of education and other resources on there for everyone in the new year.
Thanks, Keza. And finally, well, not finally, because I'll introduce myself shortly, but Gio, would you like to introduce?
Yes, my name's Gio, and I've had the pleasure of working with the team for the last 18 months and being part of this dynamic grassroots organisation. We've been involved in many projects, which will be coming up later on. And one of them, obviously, is the My Medical Choice, but we're going to explain more about that later. And one of the things also we're doing is on the new website is all the new articles to do with better health and how to look after yourself. So that's some of the things I'm involved in. There's also community care projects that we've done webinars for, which is basically empowering people to help look after themselves. So going into the new year, I'm going to step into more of that role as well. I'm working with the People's Care Alliance group. I'm looking forward to that.
Thank you, Gio. And I am Amanda. For those that don't know me, I do help where I can with the hub support. I've been helping Mags on the website and day-to-day kind of questions that come in to PHA, so it's been a really interesting and varied role, and one that I've loved, particularly being able to talk to people in local communities who are really keen to set up hubs, and that's something that I am looking forward to taking into next year with extra hub support and resources that I will talk about shortly. Also feel it's important to mention those that can't be on this call today. So that is Catherine. Obviously everyone should know Catherine, who's been doing all of our interviews pretty much, well, majority of them, and has really been helping to spread the word about what we're doing. Did an incredible interview with Pam Gregory last year, which really helped propel us internationally. And we had Charlotte, who along with Jane has been helping on the social media side of things, as well as PFFA work. And Phil, who is one of our directors of the CIC, has helped a lot with the Youth Hub Blueprint and is great at the sort of project management side of things. So is really keen to get involved in the mental health project next year as well. So firstly, we will go into what's been going on at hub level, because I think that's really important, and what we ultimately set up to do was to help inspire people to set something up in their local area. So it's been an incredible year, very much people on the ground doing some amazing things. We have got over 100 Telegram groups, which are all on the website. But I estimate, and I say estimate because it's really difficult to find out exactly what's going on. Not everyone is on Telegram. Some groups are doing things offline. But there's between about 60 and 70 hubs at varying stages. So that is things like virtual hub networks where they don't have a physical premises. They have been creating a network where they can signpost to local practitioners in the area. There are hubs that have been creating mental health focused initiatives, some that have been doing some educational workshops throughout the year, and also support networks for each other. So not necessarily putting forward services for the community, but actually building from within and supporting each other, and just naturally growing that and getting more and more people involved. There have been wellbeing sort of workshops that they've been doing. They've been collaborating with different organisations at local level, so things, groups that are already setting up or have set up, are more established. They are working together to provide more support in the community. Something that I did quite recently was a talk at a local event in Hove, and I did a Q&A for what I thought and the questions that I received a lot of, as to why, about hubs, about PHA. And so they are on YouTube, and we will link to them in the description. They're only a few minutes each, so very easy to share and sort of break down the essential questions. But if you have any further questions that you think you'd like answered, or other people have asked you about, then please do get in touch, because building that is going to be part of my project that I'm doing next year, as well as the resource library. We have also got a collaboration underway with Positive Living Communities. We've been sharing a lot of what they've been doing. I think it's a fortnightly call. Need to check my notes, but yeah, next one is Wednesday the 20th at 8 p.m. and it is a chance for all hubs, whatever level you're at, people that want to set up a hub, even if you haven't got a team of people yet. It's a chance for you to all get together with like-minded people and discuss ways forward and how you can move things along. And that's with Paul and Matt, who have done a lot of the hub support calls, and we're really keen to support them because they're doing some fantastic work. It's a free fortnightly call. As I say, it's the next one is Wednesday the 20th. I am waiting for confirmation, but I should imagine the next one will be in January after that. So that is what's going on in the UK hub community, but I know Lisa's got some updates on what's going on internationally as well.
Yeah, so when we launched PHA in the UK, we just couldn't have imagined how quickly it would become a global initiative, you know, in such a short space of time. And we've already mentioned Pam Gregory, but that was certainly instrumental. Catherine's interview with Pam back in June 2022, seems a long time ago now, really did escalate things internationally. So just a quick update on some of our countries and what's happening. Australia and New Zealand, from strength to strength, and they started working together more on things like Wellness Wednesdays and featuring presenters from both countries. That collaboration has provided much information covering many different healing modalities, all of which are available on their Rumble channel. And you know, our partnership with CHD Europe has also led to Australia and New Zealand joining an organisation called the Door to Freedom, which are an organisation that are fighting back against the WHO pandemic treaty. This collaboration has led to some really great connections for the New Zealand team and enabled them to share content through Door to Freedom and widen their reach. So it really does demonstrate the importance of collaboration. Australia at the moment are talking with an organisation called My Place Australia, and they are very similar to what we will develop into the People's Alliance. So they are already looking at health within communities, food, lawfulness, and so a collaboration there, because Australia have struggled a little bit in terms of, first of all, volunteers, but secondly, just the size of the country and the fact that people really are, you know, quite spread out. They found it quite difficult to get hubs open. So a collaboration with My Place will be amazing, and I believe they've already got 180 operating hubs. So again, it's the collaboration. In the US, the major challenges faced there are the size and diversity of the country. So despite the challenges, PHA is now well established with actual virtual groups in the east, on the east and west coasts, including northeast, mid-Atlantic and southeast. Plans for 2024 include a focus on youth wellness, with initiatives to mentor young people and create virtual groups led by young people. There's also plans for a family-oriented event on children's wellness to be held on the US-Canada border with presenters from both countries represented. And in May 2024, PHA are hosting a holistic integrative mental health conference, which has already attracted interest throughout the Northeast. Oh, and they've just, Cam Gregory's just agreed to do a Zoom with the US team. So I think that that will open a lot of doors across the country and bring people together and into PHA. In other news, Slovenia have just launched their website and now have 2 physical hubs with another 4 forming. The team's focus for 2024 is in spreading the word about PHA across the country to encourage people to come together and create community hubs. So that's fantastic. Portugal have been working hard all year. They've overcome several challenges, but now have a physical hub in central Portugal and a second one being formed in the south. And in addition to these that I've mentioned, you know, there's so many other countries expressing an interest in getting together and rolling out under the PHA umbrella. Malta are just about to launch their PHA and PFFA websites, so there's lots going on, and it just goes to show that the original very simple vision is exactly what the people want and what the people need. So I'm excited to see what comes internationally and in the UK in 2024.
Brilliant, thank you, Lisa. And Kerry is going to give us a little update on what's been going on education wise this year, because there has been a lot, hasn't there?
There sure has. I absolutely love being part of the PHA because it's so positive. And one of the great things is that we are able to offer free presentations in the form of webinars and roundtables. This year, we've sort of loosely followed a social media plan whereby we've had themes for the month. For example, one month we had mental health awareness, and Jane will tell you more about what she was involved in, but we had some webinars and some roundtables. Amazing people offering their time freely, including our ambassadors, but also the general public. So I think we have over 130 recordings now on our YouTube and Rumble channels, which is phenomenal considering they are all free resources, and I'm sure they're going to be on the new website too. With regards to next year, we want to streamline, mainly because it takes so much time and effort just to put one together, from the first initial correspondence right through to the uploading onto the channels and then the sharing. But also, you know, thinking that hubs should take priority. So they should revolve perhaps about what the hubs need, what education would they like to see, how can we help hubs and, you know, and our local communities. So that's how we would like to take those forward for the new year. In addition, we've had 2 very successful workshops this year, and they've been with 2 of our ambassadors. So Dr. Gar Chalfont did a fascinating 4-part workshop on dementia, and our other ambassador, or one of our other ambassadors, June Tranmer, did a workshop on Touch for Health healing. These workshops are slightly different in that we ask for 50-50 basis so that we can raise much needed funds for core operations. However, it's important to remind everyone that this is a suggested donation way of raising money, so they are still free to those people that need them to be so. So if you have any ideas for workshops that you would like us to facilitate, or if you'd like to be involved, please get in touch. Wellbeing Wednesday, hopefully you might have seen some by now. Again, I think there's about 60 recordings on our YouTube and Rumble channels, so if you haven't seen them, please go ahead and have a look. These take place every Wednesday morning, 7:30 a.m. to 8:30 a.m. We offer emotional, physical and mental well-being in some form, with tips, advice, sharing of information, always a little bit of fun. Sometimes we wing it. And again, we ask for your feedback and your ideas, and anyone can join. So if you can't join live, then you can watch a recording. So please do get in touch and let us know what you want us to help you with in 2024.
Thank you, Kerry. And then we're going to move on to our partners and affiliates. I think it's a great lead in after talk of workshops and particularly raising money so that we can continue with core operational costs and that collaboration piece. So Lisa is going to give us an update on that, followed by Gio, who will talk about MMC, My Medical Choice.
Yeah, so during 2023, we've continued to make very valuable connections with people and organisations doing amazing work, both here in the UK and around the world. We've collaborated with partners, as Kerry mentioned, such as Dementia Pioneers, to provide workshops aimed at training the trainer within our hubs and communities. And there'll be more workshops to follow in 2024. We've also done a number of partner interviews, providing information in areas such as holistic dentistry, heavy metal toxicity, EMF protection, just to name a few. And this year, we've also brought on a number of affiliates, which have allowed us to offer discounts to PHA members, whilst providing a source of funding for PHA core operations. It's important to say that we vet all our affiliates prior to collaborating to make sure that we're happy to share products and services. And in fact, I won't endorse anything personally that I haven't tried myself. So we will always welcome testimonials from anyone buying from an affiliate. There's been lots of work going on My Medical Choice, which is Gio's baby. So I'll pass that one over to him.
Yes, hello. My Medical Choice, basically, we've partnered with them, and what they're about is making sure that your medical directives are respected during an emergency. And that was a fantastic project, which is really exciting. What we do, we set up a system where if you need any help in hospital, you are protected. There is certain legalities which we have in place, which we can help you with. We're empowering people. So the PHA doesn't just empower people with their health and the different things we've got on our sites, being with the mental health, physical health. We also now cover the emergencies as well. So we've reached out with My Medical Choice and partnered with them. And it is also a PMA, it's a private members association, and it is a fantastic system which is worth checking out because it will actually help look after you and your loved ones and make sure that maybe certain medical procedures, you make sure that you're looked after, you don't have them, or you are respected, whatever your choices are. And it's a very exciting system that I think a lot of people are going to be amazed to see what we've done. We have a new website being launched. The PHA have used our own developers working with them. And we've got a new site coming along soon with My Medical Choice. It's being updated. So this is a very exciting thing for all of us. I think people are going to be quite excited to see what's coming in the following year.
Thank you, Gio. Yeah, it is a really exciting project. Funding, Lisa, another one of yours.
Sure, everyone's sick of hearing from me by now. So yeah, throughout 2023, we've been so grateful to everybody that's donated either directly or via the Power of the Pound campaign. In September, we also held our first core fundraiser, which was the PHA Gala Dinner. It was an amazing night with some fantastic speakers, and it was also an opportunity to meet everyone face to face. You know, it's just lovely. We see people on screens. Thank God for Zoom to keep us all together, but you know, there's nothing like meeting in person. And it gave us a chance to celebrate the achievements and focus on our energy on some key projects. So the evening actually raised over £30,000, but perhaps more importantly, it raised awareness of PHA and inspired people to make a difference in their own community. We'd like to take this opportunity to thank our key sponsors, Republic of England, Did You Know Radio, Eclectics and Norrie HR, as well as thank everyone who donated a promise to the Auction of Promises. We'd also like to thank all of you who actually attended and everyone who placed winning bids in the auctions. Your support's really appreciated. So why do we need to raise money? Firstly, we have to cover our central running costs. Since we launched PHA in April 22, there's been a small team that you see today working full time pretty much, and most of us have received little or no compensation during that time for the long hours that have been volunteered. And that's fine, because we do it because we're all equally passionate about building a new world for our children, and empowering people to take responsibility for their health. But that's not sustainable. We do need to earn a living to be able to carry on growing PHA. And in due course, it will be the People's Alliance. In addition, there are regular running costs for things like IT and accounting, which need to be covered. So the funds from the gala dinner will be used in part to cover those core running costs in 2024, but we have put aside 20,000 of that to support our mental health and youth projects. So we'll be hearing more about those later. We do want to provide a snapshot in order to be completely transparent about how the money comes in and where it's spent. So you'll be able to see this on the website once we've released this recording. But basically, we've taken the 6 months, a snapshot of 6 months in income and expenditure from when we incorporated the People's Alliance CIC. So it's a 6-month period to the end of November. And during that time, gala dinner excluded, we had donations of £32,500. We also had some commission from affiliates, links, and workshop income, and a little bit of bank interest. So that totaled in that 6 months period, £33,500. From an expenditure point of view, we have the core costs. We need to pay some wages to people, and that together with IT support came to a little over £32,000. We've also supported some of our hubs. Where we've got the money, we do try and do that. And there are accounting fees. Now that we're a legal entity, we need to make sure that that everything is accounted for properly and reported. Donations are mainly through our Stripe account, so there are fees involved there, a little over £2,000 of fees. And the bottom line is that during that period, 6-month period where we raised 33,500, our outgoings were 36,500. So as you can see, you know, we've got more going out than coming in. And this is why we decided to hold the fundraiser, not only to ensure running costs are met, but also to enable us to continue supporting hubs and to build websites, directories, resource libraries, and support initiatives like the Mental Health Project. So hopefully that goes a little bit of a way to explaining why we need to raise funds, where they come from, and how they're spent. We've also pulled together a forecast for 2024, which again you'll be able to see on the website. But our focus is very much more about generating income ourselves rather than having to ask for donations. The donations, you know, are critical to us, but if we can increase more of the commissions through affiliates, through workshops, certainly My Medical Choice will for us be big in 2024. I'm convinced of that, because it's such a wonderful service that's offered. And with the new All Singing All Dancing website that's about to launch, I think it'll make it a lot easier for people to not only understand the importance of this service, but also how easy it is to get yourself set up and running. So those are the income sides for the forecast in 2024, and the expenses are as we've described. You've got IT, infrastructure, websites, accounting to pay for. We've got a core team of people that deserve to earn a living. No one's greedy, but they need paying so that they can carry on donating their time and efforts, full-time, best efforts, to PHA and help it grow. And we've also set aside money for project management in terms of the mental health and the youth. Finally, we'd again still like to provide support to hubs where we can financially, but this will be very much dependent on what comes in.
Thank you, Lisa. And a little update from Mags on the website. I mean, it's not little, he's done an incredible job this past year, pretty much single-handedly building and updating the current website, and about to launch the new one. So Mags, would you like to share an update on what's been going on?
Sure, yeah. The key thing that we've achieved so far in 2023 is the launch of the new practitioner directory. I don't know if any of you have been on it, but on the old, I call it the old site, but on the current site that's live, the old practitioner directory took an age to load, and a lot of people looking at the stats kind of got bored and left. So what I've done is I've recreated the practitioner directory and put it on its own server, which is much more powerful and therefore a lot faster to use. And then I took the opportunity as well to redesign it so that it is a little bit more intuitive. You can have a look at it actually at practitioners.the-pha.org, or actually if you link on the practitioner link on the website will take you there. So we're just trying to make it much more simple and a lot easier for practitioners to update their own listing and stuff like that. A new design with a map on the right hand side and the listing on the left just makes it a lot easier and more friendlier to use. So that's the thing. It launched on the 1st of December, and I'm really excited about it. And we've already got some new practitioners on board, which is fantastic. And we haven't really kind of pushed it yet. So so that's that. But that's not all, because I'm now working on a health hub directory, which again, people who have set up hubs wherever you might be, you can come in and list your hub, which will then show up with the practitioners. And also you can link to practitioners that are involved in your hub, and vice versa. So again, we're just expanding. We're going to make it a lot easier for people to come in to find practitioners or to find their local hub, health hub, with a view in the future to doing a community hub, which we'll come on to in a minute, but where we'll put everything in a directory. But so that's that, the directories. The other thing is I've been working very hard on a new website, and we are building it from scratch. Had lots of fantastic help from everybody, especially Amanda and Saz, who's not with us here right now, but she's been fantastic support, helping with the content. And we're pretty much in a beta testing phase. We just want to iron out a few things, make a few changes here and there, and we're looking to launch that very soon. The focus is on resources, again, a new design, easier to navigate, and a lot more interactivity. So we're going to have articles, a lot more articles, a news section where you'll be able to find out, what's going on, and a new video and webinars section where we will have an archive of videos or workshops that we've done or webinars that we've done, as well as what's coming up. So you'll be able to come to the website to find out what's coming up, instead of having to troll through social media and stuff like that. So just making it a lot easier. And then also we're going to have a download section where we can build, well, we can provide downloads for important things like the Detox program and the health optimization program, stuff like that. I think that's me talking far too much now, so I'll shut up.
Not at all. Actually, while we're still on the website, I don't know if Gio would like to talk about the work of the health optimization program version 2 and the detox program that was also.
Oh yeah, I missed that. Sorry.
No, that's fine, Mags. That's fine. Actually, I've enjoyed watching the new website come together, Mags. It's fantastic, got to say. But yes, we have on the site, on the old one and the new one coming up, a detox program, which is, as it sounds, it's about detoxification and helping you remove toxins from the body, which seems to be quite a popular one. And also, we have a fantastic health optimization program, which is actually been put together by naturopaths, nutritionists, homeopaths. There's a list of them that we all work together, and that is fantastic. That is all encompassing. It's got things like from breathing techniques, eating, yoga, meditation, mindsets. That was quite a big project in itself, and the version 2 is actually on the site, but it will be on the new site as well. And very, very proud of that one. When you go through it and have a look and see what resonates with you, because there's so much in there, so much data that's been put together. But yeah, the version 2 that's come out and we've got there now, people can go on and see. There'll be one thing that resonates with each one of you, I'm sure, because we've used so many therapists from different modalities on that. But yes, that's one thing that's been quite an exciting project also.
Thank you, Gio. And also the Youth Hub blueprint, which is new for 2023, something that one of our core team, Phil, helped to facilitate with our two of our ambassadors, June and Helen. That is also on the website and will be able to be downloaded again, and it will also form part of the youth project that we are looking to embark in the new year as well. Jane, would you like to share some thoughts and some figures on the social media side that you've been very, very beautifully managing over the past year?
You're so kind. Yeah, no, very, very proud of our social media presence across Facebook, Twitter, Instagram, Telegram. I think Facebook and Twitter are currently kind of almost neck and neck with followers, both nearly around 10,000 on each, which is great. So thank you for following. And if you're following, don't be frightened to share any of our stuff. It always helps us to spread the word. Engagement, post engagement, really good engagement on the Facebook group, especially Monday on the Mend and Free Post Friday, where we invite practitioners and hubs to advertise their services. And also it's kind of like sounds terrible, but a free for all, but you know, just kind of put on what you like. So that's really popular. So that's got a lot of engagement on that. Popular posts, without doubt, it was Matt Letitia at our gala dinner and his speech regarding footballers and the COVID vaccine. That has now had 110,000 views on Twitter, so that's pretty good. Yeah, it's kind of a blanket around all of the social media sites. But also, I find on Facebook, if Dr. Dave Cartland puts a photograph on, everyone seems to enjoy those as well. So yeah, that's interesting. But we're really growing. We continue to grow all the time. Maybe it's slowed down a little bit since April 2022, but we are getting regular followers, and obviously we do appreciate every one of you helping to spread the word about PHA. So thank you for that.
Thank you, Jane. So what's in the pipeline for 2024? Lisa, I think it'd be a great opportunity to introduce the People's Alliance and then obviously talk a little bit more about the care side of things.
Yeah, absolutely. I think we can all see where we're organically growing towards as we start to look more and more at all aspects of community life. So the People's Alliance is very naturally coming to a fore now, and moving into 2024, that's what we will start to create. And as soon as Mags is done with PHA website, we'll be making sure he's onto that one. You know, we've got the People's Food and Farming Alliance, we've got People's Health Alliance. Over the last 12 months, we've also been working with the People's Care Watchdog, and have created the People's Care Alliance. We've not really talked much about this at the moment, but certainly in 2024, we're hoping to move forward a lot on that one. You know, more than £1 billion of the 1.7 billion that the government committed to adult social care reform back in December 2021, they've already diverted it to other priorities, according to the National Audit Office. So once again, it shows that, you know, the government have neglected the social care reform despite persistent promises. Reform has been delayed for years and years, and it's leaving social care structurally underfunded. It's also been made abundantly clear that the cavalry isn't coming, and any real change needs to come from within. So we believe that healthcare providers, local communities, families and individuals must come together to transform how we care for our older and vulnerable adults. Our starting point in the Care Alliance was to pull together resource packs providing guidance in areas such as legal, financial and practical solutions when caring for loved ones at home or in a care home, and aimed at helping people navigate the currently broken system. In addition, we are looking at different models of care in the community, and we will be collaborating with initiatives already existing across the country where health and social care providers have got together to improve care delivery and decrease care delivery costs. Finally, we recognise the need to help and support those who are caring for a loved one, or indeed working within the care sector, helping people for our loved ones. We're looking to provide safety nets for these people who are really the lifeblood of the system at the moment, or a system that's on its knees. We've also made a short film that highlights the issues that we are facing, but more importantly, it focuses on the need to come together and create the change that we must make in order to support the elderly and vulnerable in our communities. You'll hear more about People's Care Alliance and how to get involved in early 2024 when we'll launch the film, some calls to action. So excited to see that begin for us.
Brilliant, thank you. And so obviously Mags has gone into what we're planning on doing for the website. It's going to be a very busy year, but really our focus predominantly is to make it easier for hubs and local organisations to collaborate. So the directory, which we're going to have the hub directory, which is going to launch on the current website, or the new current website. There's a lot of different websites, but the People's Alliance website is really about bringing all areas of community life together. And the community group directory will include not only health hubs, but it would include food hubs or education groups, care groups, whatever areas of society are wanting to work towards a fairer, more equitable place for all. And it will be an opportunity for lots of cross-pollination of ideas, different groups being able to come together and collaborate and share resources. So really excited for that one. As well as building the hub resource library, we originally launched with a hub blueprint, which we've learned a lot from since then, and particularly being able to chat to a lot of the hub groups in the last year, their challenges, their learnings. So the resource library, we really want to make a new hub blueprint, but make it far more interactive and engaging. So having interviews with community groups that are already established or partway to being fully established, and really hoping to inspire people to get involved in whatever area that may be. We'll be looking at things like marketing, finance, funding, even admin. I mean, it's really not just practitioner led. There really does need to be a huge range of skills in each of these hubs. So that is a big project for me in 2024 that I'm really excited for. And I know Mags is going to do a fabulous job on the website with that, along with Saz's help. And then we've obviously got key projects that Jane is going to talk about, particularly with relating to what we want to do from the gala dinner, fundraising, and how you can get involved. So Jane, over to you.
Thank you, Amanda. Yes, the mental health project obviously is a big one for us in 2024. We propose to work with existing PHA partners and establish hubs offering mental well-being. I mean, that's just a small sentence, but if you really think deeply about what that concerns, that's obviously a lot of time and a lot of effort and a lot of resources. Working with existing providers as well to train and provide support. There are just, the mental health project is huge, and obviously because we are for the people, by the people, we also welcome your ideas too. We are looking for project leads to help us with this too. So there are funds allocated from the gala dinner for this role. So please do get in touch if you feel this is you. So all help is always welcome. Thank you.
Thank you, Jane. And then Kerry, I know we briefly did touch on the developing the educational offerings. Don't know if there was anything else you wanted to add to what you'd said.
Just really in line with becoming the Pupils Alliance, the education will be broader than just health. So people might want help with paperwork, for example, and finding hub, facilities. So it will be broader, and also resources for the website. As Mag said, we need people to write articles and things like that. So it's just be a broader spectrum than we've currently had this year. But we need help. We need volunteers. Please,
yes.
Thank you.
And I think particularly volunteers across the board, really, in lots of different roles. It's been a very small core team doing a huge bulk of the work. And as we look to expand into the People's Alliance, there is going to be so many opportunities, particularly around social media and YouTube. We'd really like to expand our reach. It's difficult. Sometimes you can feel like you're in an echo chamber, and actually we really want to get as many people across the board involved. So whatever skills you have, I'm sure there is either a place for them within the core team PHA or within your local hub, because I think at local level, the general feeling is that, again, it's a few people doing a lot. So really do encourage as many people as possible to get involved. I also think it would be quite a nice idea to reflect on what we've done in the last year. I mean, so much has been achieved, but I think, we do get feedback, and not everybody is going to feel the same about ways that things have been done. And so I think it's actually a really good opportunity to have a little discussion around that. And obviously we would then invite further feedback for people that have followed up and watching this. I'd certainly like to start on the communication side for me, particularly as I've been involved in the hubs. I would love to get hubs more involved. I mean, I feel that we do try and put out invites to share feedback, what would you like, but don't always necessarily get much, or it's from the same few people. So what can we do to help communicate better to you? We definitely need to work on our communication with what we're doing within the core team, and I think doing these quarterly updates is certainly a really, really good way of doing that, and inviting questions, and feedback as well. Does anyone else have any thoughts on that?
We're all learning as we go. We can't know everything, and you know, I'm learning new techniques in web design. But no, that's one of the most important things for me is that this is a kind of a journey of growth and waking up and learning new things and brushing up on skills that one never knew one had, sort of thing. So yeah, I'm kind of agreeing with you, Amanda. I think communication is really key, and I hope the new website will aid in that. It'll be a go-to place to get information. I mean, that's going to be the main aim of it. But yeah, we need to improve our communication skills. I think on the other hand, that Jane has done an absolutely amazing, Jane and Kerry on the social media side have done an absolutely amazing job in communication. But not everybody is on social media. So that's where the website comes in, I think, as well.
Yeah, absolutely. Anyone else got any thoughts?
Well, with communications, one of the things as well we were looking into, we've discussed for next year, is visiting the hubs as well. Never mind just online, but actually going to visit them and seeing them face to face, which will be amazing because, you know, I'm just a big hugger. I love hugging people, so they're in trouble when I turn up anyway. But they're going to be hugging them all. But yes, just that alone, when we do that, I think that's going to have a huge impact as well on they can get to see us, we can get to hear their ideas, we can get to see them, what goes on, and we both learn, both of us, which will be fantastic. We make notes, and that's going to be an exciting one. So that is Bobsy Communications, but coming into next year, that's the one I'm looking forward to.
You know, I'd just like to, I suppose, reiterate that message of communication. It needs to be a two-way street. So we would love to hear what's happening at the grassroots. You know, if you're in a hub and you're doing great stuff, tell us about it. Let us help you share that with other people. And we do ask, but we struggle sometimes to actually get some of these great stories out there. So yeah, just remember it's two ways, and we're dying to hear what's going on.
Yeah, definitely. Some other feedback that we had was on the gala dinner. It was a fantastic night. It raised a lot of money, and we had a lot of people that really enjoyed it. We have also had feedback from people that have said, well, actually, it was too expensive. We couldn't afford to come. It was, you know, we would have really liked to have done something. So, you know, we've been reflecting, I know, individually and collectively on that for how we go about fundraising, because the fundraising really is key. I mean, we do not have huge amounts of money. We do not have huge amounts of resources, and we really do want to be able to continue what we're all doing, because the PHA is bigger than any single one of us now, and we really want to ensure that it keeps growing that way. And I'd certainly taken on the feedback from the gala dinner. I think perhaps, you know, for future fundraising events, it might be quite nice to do more community focused fundraising, affordable, so that more people can join, whether we do 1 or 2 fundraisers a year, or whether we encourage local community groups to do fundraising for themselves. I think it's a valuable point. We are very much wanting to make this accessible to all. So yeah, I certainly take on board that feedback for future fundraisers. Does anyone else have something to say on that?
Yeah, I mean, I think the thing is with fundraising and money, it's always a very emotive subject, isn't it? And we would always welcome different ideas on how to do things. I think, you know, it's really important whilst we would like to offer hub support, it's important for communities to fundraise for themselves. But we can't ignore the fact that we've got central costs that we do have to cover. So I think, as we've talked about the forecasts for 2024, really the fundraising to cover those is going to be more so through partners and affiliates, what we can collaborate on and provide for people using those. So I think it's going to be more commission workshop based. Certainly, I think My Medical Choice will will bring in some much needed funding. And yeah, you know, you've got to take everyone's opinions on board, and I think we learn as we go, don't we? We don't have all the answers. We've never claimed to have, but we're doing our best with what we've got. So I think we've learned a lot this year, and we'll do things a little bit different next year.
Yeah, I think so. We've definitely been a learning curve, I think, for all of us. But as you say, we live and learn. We can't, you know, get it right all the time. So again, it's about inviting the public and asking them what they want and put their ideas forward to us. So
Yeah.
you're watching, please get in touch and tell us what you'd like.
And financial transparency is key to dealing with that emotive subject of money. So it's not that we haven't previously wanted to be transparent. To be honest, we didn't have the resources to keep the accounts up to date and to be able to relay that information. But you know, it's now a legal structure. Any funding that's ever come into PHA has only ever been to help either the hubs or to keep the central costs going. So going forward, you'll see it on the website as mentioned, but we will be very transparent going forward for anything that comes in and where it goes out.
Yeah, does anyone else have any comments on fundraising or money conversations?
I just reiterate what both Lisa and Jane said, and it comes under communication, is let's have your ideas, because we don't have them all. You know, we constantly ask, but whether it's the way we're communicating, do people see a different way that they would like us to communicate with them? Are we reaching you? All these things, it's as Jane said, it's a learning curve, and we're all on the same, you know, on the same path, learning as we go.
Yeah, definitely. And I think really actually there haven't been, we did ask for a few questions and we have received some from people, and so I thought it'd be quite nice if we go over those. One of the questions that came in was what hub support is available. As mentioned, we've got the fortnightly call with one of our partners, the PLC, People's Living Communities, which is with Matt and Paul, fortnightly on a Wednesday. And in the new year, we are definitely wanting to restart the hub calls again. We used to do a fortnightly one, but for whatever reason, it didn't seem to work timing wise for a lot of people. But I think it's really important that we do have that opportunity to connect with the hubs and for the hubs to connect with each other as well and support each other. So I'm definitely keen to get those going. I would love to do some interviews with some hubs and allow others to come and listen and ask questions. If you're keen to do that, then please do get in touch. But also if you have any other ideas as to what hub support you would like, we're obviously going to be building the resource library, so that will include interviews. It will also include any documents that we've sort of collated ourselves, or if we've been sent from other hubs that have been doing things. That will all be going on the website in the new year as well. But really keen to get feedback from you as to what support you need. Another question that's come in: how can we remain grassroots as we organically grown and remain truly for the people, by the people? Does somebody want to take that one?
I think by listening to everybody through these communication channels and aligning with or working with people that we align with is obviously foremost. But we can only be by the people if we have the people. So we need the people to help us. As you said before, we're a very small team and we can't do everything. So please come forward and help us. Tell us what you want. Tell us how we can help you. What do you need in your local communities? Let's work together.
Yeah, because there's some brilliant things going on. I've heard some amazing ideas, particularly around how people can support local people who can't afford to pay full price for treatments and things, and there have been some brilliant ideas. That's part of the Q&A that I've done on the YouTube video, so we will definitely post a link to that. But absolutely know that if we all come together, everyone's got different views, different thoughts, and how we can really keep this grassroots. But it is absolutely about communication, and we certainly welcome everybody feedback, whatever that may be. You can email us at info@the-pha.org, and those emails are monitored by one of our wonderful volunteers, Mary, and she will forward on to any one of us. Finally, another one of the questions is, what is the criteria for joining PHA as a partner or affiliate? And how can we ensure we're working alongside those that are fully aligned with the vision? So Lisa, do you want to take that one?
Yeah, I mean, the partners and affiliates part of what we do is huge, to be honest. Really, I'm definitely hoping Gio will get more involved, because he's been heavily involved in MMC this year. But you know, for most of the time, it's been me meeting with, engaging potential partners and affiliates. It's a big, long process, because we need to make sure that we are aligned in our vision, and that there is something to collaborate on. So I suppose what I'm trying to say is, it's a lot of work, and we do need help in that area, because things fall through the gaps, because there just isn't the manpower or person power at the moment to actually meet with all the potential partners and affiliates that we'd like to, you know, because it's not just a case of bringing somebody on board. You've got to nurture that relationship and work together. So this can go on for months, you know, so we could do with the help. We've talked about volunteering. If anyone is interested in getting involved in the partners and affiliates, you'd be very welcome to have a chat and see where you can fit in on the team. But it's been the most rewarding thing that I've done, possibly, I think, since we launched PHA, because I've just met some amazing, fabulous people and organisations that are doing really wonderful things. I mean, I've learned so much about my own health and my family's health, and really living, you know, your best healthy life, just from talking to all these people. So it's a very rewarding thing to get involved in. I'll stop waffling on now, but yeah, if you think that if you're either a potential partner or you want to recommend them, one thing I will say is, please find your way into my email, because if I do get an email, we'll try my very hardest to always respond to people, because there's nothing more frustrating than that. But if you can get to me via email, that's the best way. Lisa@the-pha.org, or use the info@pha.org, because that will find me as well. But I'd love to see more people coming on board, basically.
Thank you. And then that really does lead us into how can you help, which I think Gio's going to.
Yeah, I'm sorry you get to hear my voice and see my face again. But yeah, basically, there's an abundance of skill sets out there. We know this, and we'd love to have you guys volunteer and time and expertise and help us achieve more in helping moving forward with what we're doing. We are achieving a lot, but it's a lot of it what you people have done out there with us together. It's an amazing skill set, and we just need more of that. Also, join us with our social media platforms, share your posts. I mean, I see what goes on with on the Facebook with the PHA and the expertise. People ask questions. I just monitor to see the replies, and you can see what's going on, and some of the different organizations, be it different therapists helping. It's fantastic, but we need more of that as well. But that is brilliant to see. Also, we understand how difficult things are out there, especially during these times at the moment, moving forward. And we do have something called the the power of the pound, which is where it's like donating £1 a month. And that actually goes to help the organisation move forward. It helps us help hubs. You've heard of all the different projects we're involved in, and we use that to help each project. So that is a big thing we need. I mean, one of the things I've noticed, we say for the people, by the people, but actually one thing I've come to learn, it's we've put things in place to help people, but it was you, the people, that have picked it up and ran with it, be it with hubs. We're constantly hearing of all different hubs that have opened, and that is fantastic what's going on. So you have done so much, and basically we want to thank you for that. But donating £1 a month, the power of the pound, helps us achieve more with all the projects you've heard of and all the projects you're going to hear of, because there's many more in the pipeline that we haven't discussed. So that's a big thing, and it helps us set up communities moving forward, which is what it's all about: empowering us, empowering you, so you build up and pick up and look, help each other. But that's a big thing.
Thanks, Gio. So we hope that this has been really informative. It just leaves me to wish everybody an absolutely fantastic Christmas and New Year. Try and get some rest. We've achieved a lot this year. We've all worked hard, whether we're in our communities or in the core team, and we deserve a break, I think. We would like to thank everyone for their involvement wherever that's come through, and would like to share a little video with you that we put together for the gala dinner, and it's people doing it in their communities and talking about the challenges, the wins, all that great stuff. But hopefully you'll watch this and you'll be inspired.
It just sounded like it was exactly what I was feeling and thinking, and the people in it were very like-minded, and I just felt right at home.
Listening to Catherine with her vision of returning the responsibility of healthcare to the people was just amazing.
We looked at these mission statements. I was ticking them, tick, tick, tick. I thought, well, hang on a minute, that's exactly what was in my head. So that's really why I got on board. I was so excited. Thought, wow, this is a way to go forward.
It was almost instinct. It was like, yes, that's like the missing link that we need.
For me, it was a no-brainer. Bring community together, empower them, and help us to look after our own health.
It was a vision that I've had, for many years. We are wanting to bring community together, wanting to bring holistic health into the forefront.
PHA was an opportunity for us to educate people so that they could look after their own health.
I see the PHA growing, not just stay in health. We've already got groups that are springing up that are concerned about education and our youth.
It's with the size of Australia, there are lots of other groups doing similar things. And so this is where we're starting to look at, well, how do we collaborate with those people that align, that have the same values, the same vision? How do we collaborate so that we're not reinventing the wheel?
Getting older people with skills to help share those skills with the younger people, and we want to proliferate. We want to go round to all the different neighborhoods so people can have somewhere they can walk to, and it needs to be some place that is just open and welcoming. People can just walk in. We're trying to help people to help themselves.
I, for one, am a huge believer in community. There's so many studies, aren't there, that shows time and time again that when people are isolated, they start to develop health issues. And so, we want people to be able to say, let's just go up to the health hub today, let's have a coffee there. Hopefully we can have a huge smorgasbord of treatments available for different levels, and people can really say, this is ours.
What we have managed to do is create a really wonderful network of therapists who are in different modalities and really want to get on board with us. It's about bringing people together
and helping them to feel valued, to feel empowered and supported.
I feel like I've got backup. You know, I feel like these guys have got my back.
During the floods, there were a lot of people traumatised. I mean, we had these major storms. They weren't normal storms. Hawke's Bay was severely flooded. So was West Auckland. People were cut off. There was no services getting to many of them. They weren't even receiving information of what was going on. So PHA, I was having mixed reports about what was happening, didn't trust what I was hearing. So I just got in the car and went. But within a day of me saying I was going to go, all of the community rallied. People were giving me money for petrol. They were giving me supplies to take, food. And when we got there, we were able to speak to groups on the ground, connect communities, literally go around community and say, what do you need? What's available? What's missing? People would just burst into tears because they couldn't believe someone was actually turning up, that their voices were being heard, because the government weren't listening, the councils weren't listening, there was no help, there was no army.
We're learning as practitioners, and then that allows us to then be able to provide such a beautiful service because we're all being able to understand from all of these different perspectives. I see that as a really key part of what PHA stands for.
We've already got 3 primary physicians in place, 3 mental health coaches, we've got 3 doulas, so that's where the pre and post-pregnancy support comes in. Lots of fantastic therapists. We've got a PA, we've got yoga specialists, a phlebotomist, potential clinic managers. We're all ready.
The challenges are people still think we're a bit weird. But, you know, it's okay because I have friends in that neighborhood who are very supportive.
See, New Zealand is a really interesting country to be in because there's such a mix of people from around the world that end up in New Zealand. So the challenges have been to encourage people to come together and talk through their differences and to realise that these PHA hubs are for everyone in the community. It's about talking with everyone that comes together and making it work for everybody. And that's the beauty of it. And that is, for me, the way forward. As a community and as a people, we need to be talking together and learning to hear what others have to say and not just ruling somebody out because they're in the minority, but actually bringing everyone together on the same page.
Bringing all of these different ways and perspectives of health together. There's so much wisdom that is held there. There's a lot of incredible expertise that are already held in the system. But what we want to be able to see is this is not the only way that we can work together to be able to support somebody in their health journey, in their own healing journey that pulls from all of these different perspectives, whatever they need, so that people can find their own way through that.
So 4 weeks in a row, we hired out a community hall in the local village, and various therapists were down to welcome people who perhaps needed some more guidance. And we got the word out. People actually saw our advertising, which was great. Unfortunately, because of funding issues, we then had to stop after the 4 weeks, just as we were getting into it. So we're looking at getting extra funding so that we can start that again.
We basically want everybody that's interested to come along.
Health hubs definitely just need more people to come along and help do stuff.
So definitely more funds and just more support to help us to support individual hubs. That's what we need.
We obviously need long-term funding really to find a physical health hub, whether that's a mobile one or a fixed one. It'd be great to have both and to be able to go and do like mobile drop-in health hub sessions, but also funding just for things like having our business address, because we don't have a physical health hub. We'd have to hire a business address and we have to pay that on a monthly basis.
I know it's difficult and it can be scary. It took me a long time to, set up a community wellbeing afternoon, and I haven't done it on my own. I've got a great team behind me as well. But just taking that first step forward, get on the phone, just have a chat with me or one of the other ladies, and just take that first step.